Healthcare advocates are launching a charter challenge against a provincial law that will allow some hospital patients to be transferred to a long-term care home not of their choosing. The Ford government says it will ease pressures on hospitals, while advocates say it will cause significant mental and physical harm to elderly patients.
She gets worried, she gets alone, she gets afraid. I don't know what to do. I don't know who to talk to because she's no longer able to live on her own.
Reiner Pethke's 95-year-old mother has been on a wait list for a long-term care home for more than 2 years. His 39-year-old son, who suffers from an aggressive form of MS, is in a nearby home. Ideally, obviously, you would want your mom in the same home as your son.
Well, ideally, right, and he could actually support her, even though he has bad MS, he's of sound mind.
He's concerned the new bill not only violates the rights of elderly patients, but could possibly take spots away from people like his mother, who have been waiting years. So you're worried that this bill just kind of pushes your mom even further back in line?
Well, not only does it push her further back in the line, but the day is going to come. I mean, it's winter, what have you. We take her out from time to time. Let's say that she slips or falls, anything happens, she's going to wind up in the hospital. And under Bill 7, they can ship her almost wherever. It would almost be more humane to have my mom, if she wound up alone and afraid somewhere, to be eligible for MAID. And that's just a sad thought.
The Ontario Health Coalition calls it a horrendous bill that violates Section 15 of the Charter, that every individual is equal under the law without discrimination based on age, and Section 7 of the Charter, the fundamental right to life, liberty, and security of a person.
We believe the bill actually violates all three of these rights in a number of different respects.
Patients can be forced far from their loved ones, up to 70 kilometers away in southern Ontario, or up to 150 kilometers away in northern Ontario. They could be transferred into homes in COVID outbreak. If they refuse, they could be fined $400 a day. There's no ability to appeal the legislation.
Many long-term care residents will die in an unwanted home before they reach a home of their choice.
The only recourse is to launch this charter challenge and ask the Superior Court of Justice to strike the law down. But Ontario's long-term care minister says the law will ease pressures on hospitals overwhelmed by ER visits and surgical backlogs. There are currently 1,800 patients waiting for long-term care homes in hospitals.
It is a better quality of care. It is where they want to be. It is in the best interest of people who are sitting in acute care beds, keeping beds away from people who need them and from people who want to be in long-term care.
Ontario's long-term care minister says last week alone 330 ALC patients in hospital were transferred to long-term care homes. Meanwhile, Ontario's Health Coalition hasn't launched this charter challenge just yet, but they say they will as soon as possible. They are looking for funding from the public. They need about $500,000 to successfully complete it. For City News, I'm Yazdani.